The C2 fracture is either an odontoid fracture or it can be another type of fracture, which is the C2 traumatic spondylolisthesis, or we call it Hangman fracture. In this video, we'll discuss the mechanism of injury, the presentation, the classification, the imaging, and the management. I am Mohammed Raz, and this is your knowledge platform about the brain, spine, and beyond. The C2 type fractures or the Hangman fracture can happen as a result of hyperextension injuries, and it might have a different degree of either slight displacement between the fracture lines, or it can also lead to some degree of angulation, which we will mention in that classification later. The patients will usually present as most of the other fractures that we mentioned in the craniocervical junction, mainly by neck pain, and they might have some sort of neurological deficit, but this means that they again have a higher degree injury that caused a ligamentous injury and also injury to the spinal cord. Similar to other injuries in the craniocervical junction, CT is usually the most used imaging modality. X-ray can be used, but again, CT is the most commonly used in an A&E setting. You can also use an MRI scan to assess for the ligamentous injury. The two things that you need to look for when assessing a C2 Hangman fracture is, one, what's the degree of displacement there, and also what's the degree of angulation. And this is how you can identify what grade, or you can make up your mind about what needs to be done for this patient. Let's have a look on some of the imaging. So as you can see in this picture, it's usually better to start with on a sagittal image. So if we scroll through laterally, you can see there is a fracture line through the C2 pars, and on the other side this similar type of fracture. And as you can see, there is an angulation of the C2 on top of C3. So it has this is why it's called a C2-3 traumatic spondylolisthesis. Again, if we go on an axial view, again here you can appreciate the line of fracture on the right side and again on the left side here. If we look into another case, which sounds a bit more severe, again on the sagittal imaging you can see the line of fracture on the pars. If we go to the other side, similar type of fracture with a higher degree of displacement, which again leading to a higher degree of angulation of the C2 on top of C3. And you can see this patient is intubated. This means that this patient has probably a higher degree of injury that is causing him to be requiring intubation. And also you can appreciate the amount of the prevertebral swelling here in front of the spine. In terms of the classification of the Hangman fracture, this is classified according to Levine and Edwards classification. So we have type 1, and as I said earlier, you have two main things that you need to think about it. First is the displacement and then the angulation. So to start with, the type 1 would have a displacement of less than 3 millimeter. The two numbers that you need to remember in this classification is 3 and 10. And the two words that you need to remember is the displacement and angulation. To start with, type 1 would have a displacement of less than 3 millimeter, as you can see, with no angulation. And then type 2, you would have a displacement more than 3 millimeter, but there is an angulation, but it's less than 10 degrees, sorry. And then we have type 2A, which is basically no or very minimal displacement. We're not interested in the displacement here, but the angulation is more than 10 degrees. So as you can see, we're focusing either on the amount of displacement or the degree of angulation. And finally, type 3 is basically the whole facet is dislocated between C2 and C3 bilaterally. In terms of the treatment for the Hangman fracture, mostly of the lower degrees of the C2 Hangman fracture can be treated conservatively with a collar. Other patients who might have a higher degree of angulation and you're worried about the instability, then a halo can be an option. And finally, a fixation can definitely be done if there is a severe angulation, and also specifically if it's associated with a neurological deficit, then a fixation might be required, especially in types like type 3 injury. I hope you enjoyed this video. Please make sure to watch the previous videos as we're going through all the types of the craniocervical junction and craniocervical junction fractures, and stay tuned for the next one.